Welcome, everyone, to the lightning presentation round. This is for clinical trials and outcomes, and I will be a chair here. I'm John Sims. I am a neurologist and head of clinical development at Eli Lilly.
And my name is Elena Solopova, one of the second session chairs today. And I'll go ahead and start. So there's a lot of awesome talks lined up, but one of them is mine, so I'll leave it up to you to judge. And I'll introduce the first speaker, which is myself, and start the timer for me. So the title of the presentation is Fatal Iatrogenic Cerebral Amyloid-related Encephalitis in the woman treated with Lecanemab for Alzheimer's disease. So in plain English, I will talk about an important case of death in a clinical trial. ARIA. Although this research comes from the Music City, ARIA is not about music. Amyloid-related imaging abnormalities is a common side effect of anti-amyloid therapies, including Lecanemab. And I'm spelling it out for you to ask if we should call this side effect an imaging abnormality, based on the clinical profile, the neuroimaging, and the neuropathology of this case. So first, a little bit about the patient. Genevieve Lane was a 79-year-old woman. She was enrolled in phase 3 clinical trial of Lecanemab, and after each infusion, she developed severe headaches that sent her to bed. And after the third one, she went to the hospital and died after 5 days. And let's look at her brain. At the neuroimaging side, I'll show 3 features, going from the most conspicuous to the least. So comparing the pre-trial MRI to the post-trial, we see severely enhanced white matter disease, as indicated by those bright spots, those white areas. Now looking at the same image, we can see the brain swelling. You can see on the bottom here that the grooves of the brain are severely distorted. And lastly, in another sequence, we can see the microhemorrhages. So before the trial, there were 4, with 2 shown here. And after the trial, there were over 30, with 8 shown here. In addition to the in vivo MRI, on the postmortem MRI, there were even more microhemorrhages revealed. So that's a neuroimaging, and in neuropathology, we see the microhemorrhages as the black dots, here at arrows. But what's happening inside? And because the picture can be both 1,000 words, but in video can be worth 1,000 images, instead of this image, I'll show you a video of the ruptured vessel, where we can see severe deposits of beta-amyloid in red color. And there's also beta-amyloid deposits in the leptomeninges here. And now let's look at the neuroinflammation. So the CD68 marker shows there's a lot of macrophages and activated microglia in the perivascular spaces, with more intense staining at the areas of severe swelling. And there's also immune cells, the inflammatory cells in the parenchyma of the brain and in the leptomeninges as well. So overall, the inflammation pattern is similar to the encephalitis cases we've seen with the beta-amyloid vaccination. And I'd like to ask you again, based on the clinical significance of the side effect, does it make sense to call it ARIA? As we've seen on the clinical presentation, the neuroimaging and the neuropathology. But regardless of what we call it, we need to study it more to understand how to manage and prevent it. So I'm ending with the most typical conclusion that more research needs to be done. But because the cases with ARIA are rare and can be a bottleneck, if you're aware of such tissue, come talk to me at here or at the poster session. Thank you.
Thank you.